Hi, my name is Dr. Rowe. I'm a family physician here at First Primary Care, and today we're going to talk about acid reflux. So I'll start first by just talking about the pathophysiology of acid reflux. So normally when you eat food, you'll mechanically chew it up and the food will go down the esophagus. It will pass through the valve will open and the food will go into the stomach. The valve closes and then the stomach will release acid. And so the lining of the stomach can withstand the acid, but just like how the name implies, acid reflux, the stomach contents, the acid can actually reflux or go back up into the esophagus, which the lining of the esophagus cannot handle or withstand the acid. And so you'll have that heartburn or that burning sensation. And typically, acid reflux can come and go. It only usually lasts for an hour. But if you're having acid reflux, which is more intense, let's say it lasts longer or lasts longer and it occurs on a more regular basis, that condition is then called GERD or gastroesophageal reflux disease. The two most common symptoms of acid reflux is heartburn, a burning sensation that you have on your chest, which lots of patients get after a meal, or regurgitation, which is the stomach acid that flows back up in the back of your mouth or throat. Other symptoms can include like feeling nauseated and sometimes with vomiting. You can with a raspy voice or sore throat, and also maybe an unexplained cough. And there are some that do get problems with swallowing. There are several over-the-counter medications as well as prescription meds that your doctor can prescribe you. This includes like antacids, histamine blockers, and even proton pump inhibitors. And what these do is they reduce the acidity, or in other words, neutralize the acid in the stomach to relieve your symptoms. There are several tips that I share with my patients. And first and foremost, lose weight if you're overweight. I will make dietary changes. So I would avoid large meals, and avoid foods that make the symptoms worse, such as anything that's peppery, spicy, fatty, greasy foods. This even includes chocolate, peppermint, alcoholic beverages, and even caffeinated drinks. I especially would avoid high acidic foods. So timing of your meals is also important. You want to give your stomach time to empty. On average, it takes 3 hours to completely empty. So, dinner is the biggest one that I always recommend, where you try to avoid, eating dinner 2 to 3 hours before bedtime. Another thing you could do is also elevate the head of your bed. When you increase the angle, it actually allows gravity to keep the food contents down, which can help your symptoms. Now, this isn't the same as piling lots of pillows behind your head, because when you do that, you actually are crunching up your stomach, and it's not as effective. So what I usually recommend is you can get blocks of wood or even books, and then place it underneath the head of the bed to increase it by 6 to 8 inches, so that your bed can be this way. And then lastly, if you do smoke, you should stop. And that's pretty much it. And so the pricing for these meds can be as low as $6 a month. What we offer differently from the traditional model is that the direct access to your physician, and what that does is if you have any questions or hey I noticed this, it's just a lot of reassurance and just giving them guidance. Here you can always ask as you go through, and it's also nice when you do follow up with patients, because we don't charge them when they come back. They can ask, hey doc, this is my new diet, what do you think, what should I adjust? So if you'd like to learn more and have a direct relationship with your doctor, please go to firstprimarycare.com.